What's up, guys? Grand Training Systems. I hope the echo in here is not too bad. I'm using the training room at Sportsfelt, my neighboring partner in gym. So the manager filming, Andy, appreciate it. Thank you. Today we're going to talk about Shin Splints. I don't really know what you guys call them in German. Andy, what do you guys have a name for these?
There's no special name.
Okay, that's cool. The real special name is medial tibial stress syndrome, but that's for like the anatomy geeks and physios out there. So basically in the States, they're known as Shin Splints. Basically what it is it's pain behind your leg bone, if you will. It's in the posterior border of your tibia, but again, for most people that's not going to make any sense. So basically what it is it's coming behind the leg bone right here. And it's pretty easy to test yourself to see if you have it, because all you have to do is basically just press right on this muscle and see if it hurts. And if it does, then you either have the problem because you know from playing sports that it exists because it hurts you, or by pressing here, if it's a bit sensitive and painful, as mine is not at all, then it shows that you could be getting this problem. So basically most injuries the root of them come from a weakness or a tightness. Usually not both, but I think the funny thing with this injury is it comes from a whole bunch of different things, including both usually a weakness and a tightness. So we're going to go through 3 things in subsequent videos, because this one would be like an hour long if I discussed it all here, which I tried before and it didn't work. So the other videos are going to show the way we can strengthen the muscle so the pain can start to go away, the way that we can stretch the muscle so that the mechanics of the ankle go back to being normal, and the muscles are not put under so much stress due to being tight, and just some cool, unique ways that we can massage the muscle to help get rid of some of the scar tissue and some of the swelling and some of the chemicals and things in there that are just making it hypersensitive or more painful. So right now, this video will be a bit short. I just want to discuss what it is. So basically, let's start with some simple anatomy. I think everybody knows this muscle right here, known as the calf to most people. This muscle is actually called the gastrocnemius. So in this video, I'm going to call it for short the gastroc. Then we have a lower muscle down here, which is called the soleus, which for the video, I'm going to call the soleus. Now the difference between the two is the gastroc is going to connect above your knee. So when you're standing on your toes, when you're standing up and getting on your toes, your gastroc is doing a major portion of the movement. The soleus, the smaller muscle, does not connect above the knee. So when your knee is bent, it's doing a lot of the motion for your plantar flexion, for you standing on your toes, if you will. Some research out there says the soleus and the gastroc together are about 70 to 80% of your ability to stand on your toes. And even if that's true, that still leaves 20 to 30% left for the other muscles to do the job. And this is where the shin splints are coming from. So let's go back to that area that I was talking about, right behind your leg bone, if you will. Right in here is the other 30% of those muscles, if you will. The actual muscle that's being affected is called your posterior tibialis. Posterior because it's behind your bone, and ironically enough, in front you also have the anterior tibialis because it's in front, not behind. So most likely, if the pain is here, your pain is coming from the posterior tibialis, which is where we see most shin splints take place. Now, with that being said, the compartment, if you will, where the posterior tibialis is, also has 2 other muscles in that area that are going to be affected. One of them is going to be flexing your toe, and the other one is going to flex all of your feet. So as you will notice in the next video with the towel exercises we do, is what the video is going to entail, it's going to be consistent of exercises where we're basically using our foot to strengthen this area. But now that you know that there's a couple other muscles back here that are connecting to the feet, this is why we're using the foot and the muscles in this area to get rid of the problem here. So hopefully that makes a bit of sense. It's a bit confusing injury because even though the pain is coming from here, as you will notice in the next video where we talk about the strengthening exercises, most of them are coming from here. The exercises, we're strengthening the toe, we're strengthening the arch, and I'll discuss that a little bit more in the next video of why it's like that. But first, I want you guys to figure out if you have this injury. Sit down on a table, relax a bit, get right behind that leg bone, your tibia, if you will, and just kind of poke around and push around and see if there's any bit of pain there. And if there is, then you definitely either already have this injury or you're getting a bit close. And especially if you're playing sports, from the tennis players to the any athlete, from the tennis players to the basketball players. I obviously specialize in tennis, so 90% of my athletes are tennis players. From the long indoor season on the hard court, now moving to the clay, we're seeing a lot of this because the legs have basically just been destroyed from playing so long on the hard court, and now their matches on the clay are longer and their muscles just can't handle it. So especially you tennis players out there that are switching from hard court to clay due to the summer season, do this test on yourself. See if you have any positive signs, meaning painful signs. And if you do, definitely watch the next videos to see how you can fix it. And if you don't, I would actually still watch the next videos because you're learning cool ways to massage this area and also kind of how to evaluate your foot and see if you could have any further mechanical issues or this maybe tibial stress syndrome, shin splints, come your way also. So check out the video. Hope this helped a bit explain what's going on, and look for the further videos explaining on how to take care of it and how to diagnose it further, alright? So cool. See you in the next videos. Peace.